Good afternoon, I'm Mayor Tom Baird. I'm joined by Commissioner Ben Baker and I'm here Jeff Swine from the Milwaukee Health Department. There have been a number of developments today pertaining to what has been known as the swine flu, and we want to report those developments to you right now. I would say at the onset that there has been a considerable change today as opposed to yesterday when we had no new cases to report. Today, Commissioner Baker will report a number of cases and explain to you more in depth how we had that increase. I am also here to say that we are announcing the closing of more schools, and I'll talk a little bit about that after I announce the names of these schools. The new schools that will be closed beginning Monday are Forest Home Avenue School, Lincoln Avenue School, Kosciuszko or Kosciuszko Montessori School, Alas High School, which is contained in the Kosciuszko building, Wedgwood Park International School, the Milwaukee Learning Laboratory Institute, which is located in the Wedgwood building, and the Honey Creek Continuous Progress Charter School, which is connected to the Wedgwood building by a common hallway. These are all schools that are attended by some of the new individuals who are being considered probable victims of the flu. The question I think probably some of you will have is, well, what does this mean in terms of the schools we've already announced, and will there be additional schools? As you can perhaps tell, the schools we are closing are concentrated on the south side of Milwaukee. Given the change that we have had in the last 24 hours with these new probable cases, the likelihood that there will be more closings has increased. In fact, it is not inconceivable at this time that we would face the closure of many more schools, or perhaps the whole district. We are not making that announcement today. Our plan is to use the next 47 hours to gain as much information as we can on a number of different fronts. First, the number of new diagnoses as they have been confirmed, in large part thanks to the great assistance of Children's Hospital. We have what we believe to be very, very good technology that allows us to analyze these cases much more quickly than most parts of the country. So we want to see what the changes are in the next 47 hours. In addition, the severity of those cases. In addition, if we are seeing an increase in hospital admissions, we know we're seeing an increase in emergency department visits. We want to see the severity of the illness, again, between now and 4 o'clock on Sunday. Given this dramatic increase in the number of cases that we have had today, I also want to get more guidance from the Center of Disease Control. Commissioner Baker and his staff have done a wonderful, wonderful job in both following the leads of the cases that we have before us and in providing guidance to not only myself, but I think to our community in what we are facing right now. But given the changes that we see happening, this dramatically changes where Milwaukee fits within the national contours of the number of cases. It's unclear at this time as to whether the increase in cases we're seeing and able to identify is because of a greater severity of the disease here in Milwaukee, or whether it's because of our great ability, again, thanks to Children's Hospital, to analyze the data much more quickly than other communities can do so. But those are the two different probabilities. One, we either have a larger onset of the disease here, or we are much more efficient in identifying the disease here, and we don't know at this point what it is. Again, the severity is something that I want to get more information on. Clearly, this is having an impact not only on our education system, but on social gatherings. Commissioner Baker will touch a little bit on that as to what the guidance he is receiving from the Center of Disease Control. But I will now turn it over to Commissioner Baker, who will talk about the numbers and touch on several other topics. Commissioner?
Thank you, Mayor Barrett. Mayor Barrett says our announcement today changes the scope of our investigation. We're going to be very vigorous in that. I want to first say that we are responding today just as we have before to protect the public's health. There is now a increase in our probable cases of what is now known as H1N1 influenza. We have 27 probable cases in the city. This is a big jump from the 2 cases that were reported earlier this week. I do want to once again echo Mayor Barrett and the great work with our partners across the state of Wisconsin, which include the Wisconsin State Lab of Hygiene and the Dr. Michael Krusek at the Children's Hospital and Health Systems Laboratory. He's the Director of Pediatric Infectious Diseases. They have techniques on the ground that references those techniques used by the Centers for Disease Control, along with our own City of Milwaukee Public Health Laboratory. In a 3-pronged approach, we're able to identify and to rapidly identify samples that are coming in, which has led to a quick increase in our case count. It's likely that this case count will change daily, and it's likely that the scope of our investigation will expand daily. As a result of this, I'm pleased to announce our partnership with 211. Residents who dial this number will be able to have their questions answered about H1N1 influenza, and they'll be answered in both English and Spanish. It's important that we have access to that hotline as we scale upwards. While we have identified more individuals that have symptoms consistent with influenza of the H1N1 type, we are vigorously following up all of their contacts. So the action that we take today is truly in the spirit of public health preemptive. As Mayor Barrett added additional schools, that takes the total to 9 that I've issued an order that they be closed. And we will be working through the weekend to make certain that we can follow up if there's additional school closure. We're once again strongly urging all individuals in Milwaukee who are exhibiting signs of respiratory illness to stay at home, to not go to work, and to not go to school. And those signs of respiratory illness, to repeat again, are fever, cough, sore throat, stuffy or runny nose. In addition, there's been much talk about social gatherings. And our guidance at this time is to invoke the order of social distancing in terms of when you encounter someone who may be exhibiting symptoms of influenza or coughing and not covering their mouth or nose, that you try to have at least a 6 feet distance between you and that individual, and then to be mindful of that, and then take the appropriate action to protect oneself. I can't stress enough how important it is to continue good hygiene. If the illness is mild, we want individuals to try and manage their illness at home with dialogue with their healthcare provider. If their illness seems moderate or severe, they should call their doctor in their clinic for recommendations or the emergency personnel at 911. We know that the severity of illness here is something that is being assessed, that's changing rapidly. So we want to make certain that there is this voluntary monitoring of one's illness and those that you care for. I can't stress enough that we are working with our partners at the state level and the CDC level as this unfolds nationally. And as Mayor Barrett said, we're in constant contact with individuals at the Centers for Disease Control and the Wisconsin Division of Public Health as we try to monitor the rapidly changing situations here on the ground in Milwaukee. So once again, to recap, we've had a significant increase in our case count to 27 probable cases. We've had these additional 4 school closures, and we will be case contact and follow up vigorously through the weekend, and we'll provide additional guidance on a daily basis until further notice. I'll turn things back over to Mayor Baker.
Devin mentioned the total 9 schools. The buildings that I identified, there are 4 buildings, but within those 4 buildings, there are essentially 3 additional schools. But in essence, it's 4 buildings plus the 5 buildings we have previously announced.